Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium. And today I'm talking with Dr. Scott Morris, the founder of Church Health, the largest faith-based, privately funded health center in America. He's also a family physician, and he's also a minister in the United Methodist Church, and he resides in Memphis, Tennessee. Dr. Morris, thanks for joining with us today.
Really glad to be with you today, Larry. Thanks for having me.
So I'm intrigued by the model of health that you have developed. In the early days of family medicine, the biopsychosocial model was adopted as a way of describing the vision of family physicians, how they thought about health and how healthcare delivery. And I think you've done a remarkable job of translating that, staying true to the full meaning of that, but translating it into a set of dimensions that the general public, as well as the medical profession, can understand. So I'm wondering if you could describe your church health model for us.
Yeah, so what you're referring to is something we call the model for healthy living, which I will come back to, but to really understand our model of care, you really have to have a deep understanding of our view of health. So for us, being healthy is not about the absence of disease. The World Health Organization would agree with that. You know, who cares if you live 2 years longer if it means 2 years longer in a nursing home? Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. So to begin with, we will argue that there are 3 goals for living. This is true for every last one of us, for you, for me, for our patients, for people listening. Those 3 things are this. Number 1, having more joy in your life. Number 2, having more love in your life. And number 3, being driven closer to those things greater than we are. Now, we would call that God. You don't have to call that God, but there are things in life greater than we are. Those 3 things are what each of us need to ultimately be healthy. Now, if we're right about that, more joy, more love, being driven closer to God, it doesn't have a lot to do with the doctor, does it? So that led us to create what we've referenced already is the model for healthy living. Now this is just a riff on the social determinants, but we would argue that there are 7 things in life that are equally important to life and must be in balance. So no one is more important than the other. So medical care is one, but it's only one. You know, as you and I'm guessing everybody listening knows, you know, our health outcomes only have 10% to do with anything the doctor, the hospital, or the drug company would do. 10%. In our country, we're spending almost $1 trillion a year to pay for those 3 things. You might argue maybe we're not spending the money very wisely. But yes, medical care is one. Number 2 is nutrition. Your mother told you are what you eat. She was right. Number 3 is movement. We were made to move. Number 4 is emotions. Number 5 is family and friends, or you could say community. Number 6 is work. We define work as those things that bring meaning to your life. And lastly, your faith life. We would actually argue your faith life is as important as anything the doctor might do. So anyway, those 7 things, we evaluate every patient we see to try to figure out where that person is, and they drive our programming within the work of Church Health.
So what you're describing is a process of care that starts with the patient and a patient's assessment of their life. Is that how that works?
Like with each of those 7 things, we have a patient evaluate where they are. Now, the doctor doesn't do this. Our health coaches don't do this. The patient does it. You know, where are you within nutrition or movement or family and friends, 1 to 10. We have arranged our 7 things in a circle. So once you define where you are on a scale of 1 to 10, you put a dot there, and then you want to connect your dots. Now the goal is to create as big a circle as possible. Now, for most of us, we don't have a circle. We have something that is not possible to roll. But where you are not doing well in your own life is where we begin. It's not the doctor imposing our view of where you are in your life, but where you rate yourself is oftentimes the very first place we address, which means that if nutrition is the issue, we're going to start with our dietitian. You know, if emotions are the issue, we might start with one of our counselors. If the issue is your faith life, then we're not going to try to impose our view of faith on you. But it's been shown over and over again that patients actually want to talk to their healthcare providers around issues of faith and how it plays out in their life. So we have embedded within our system people who have the skill set to do that, or we will connect to wherever that person comes within some sort of worshiping community. And then the doctor does what the doctor does best. And a lot of these things are not what doctors are very well trained to do.
So, Scott, it may help people. I've had the great pleasure to visit you personally and to see the church health operation. And it is one of the most comprehensive models of healthcare delivery that I've ever seen. You have, to talk about one-stop shopping, you have just a whole range. You've been talking about some of the services that you have there. You're not farming people out. You've got services, you've surrounded the primary care practice with these and added these services. So could you talk a little bit about the church health operation, if you want, the model of healthcare delivery that you've created there in your facility?
Yes, so you could argue we have built a medical Disney World, that there is some truth to that. And there is issues of practicality, is that, you know, how replicable is everything we do in every small practice out there. We get that. But we believe that all the aspects of church health are totally reproducible, and we work with communities all over the country to do that very thing. But so within just the church health scope, we have dietitians, we have health coaches, we have counselors, and we have a nutrition center. We offer dental care. We have built the largest freestanding dental clinic in America. It's 100% focused on the working poor. We have an eye clinic. We embed retinal cameras into all of our primary care clinic setting. But we are the primary tenant of something called Crosstown Concourse in Memphis, which was once a Sears distribution center. In square footage, it's 1.5 million square feet. It's the same size in square footage as the Empire State Building. But the beauty of this is it's not just church health. Within our building, we have an elementary school, we have a high school. Teach for America from Memphis is based here. We have a credit union. We have a vibrant arts community that's all part of us. I mean, our focus is on the working uninsured, but poor people need access to art. And we would also say, you know, we run a family medicine residency, but how cool is it that our young doctors being trained in what we refer to as the church health way get access and make friends with people who don't give a flip about their last interesting patient, who care more about issues of art. And you could get young doctors becoming friends with young artists. That is a better mousetrap from our perspective.
So I got to see that in action, and it's, as I say, it's just incredibly impressive that you've been able to bring all these things together. I believe you also have some what I call subspecialty services there.
So we have 20 providers on our staff. We have 1,000 physicians who volunteer with us. That's not a made-up number. So physicians who are in private practice out in the community in Memphis and are working with the Memphis Medical Society donate their time to see our patients free of charge. There's not a problem somebody could have from the cradle to the grave we can't take care of. Now, here on site, we offer 62 subspecialty clinics staffed with retired doctors. So these are doctors who 5 years ago, you would say are the best doctors in Memphis. They retire, they go play golf for 6 months. Most of them are men, at which point their wife calls me and says, can't you do something with him? And we have found a way to build them a playground where they can continue to do the work they do. But then we also have, doctors in private practice who find it easier to actually come on site with us. But literally the last patient I saw just before you and I started talking was a man with a cardiomyopathy who was struggling mightily, to be honest, beyond my expertise, but I had one of the best cardiologists in Memphis volunteering with me this morning, and I was able to with him, decide on our plan as to what we do next. It really is a Memphis miracle in some ways, but we believe this can totally be replicated across the country.
This is incredibly exciting. When I think of what the founders of family medicine had in mind when they envisioned a better healthcare system, they really would all be smiling mightily now at what you've created here. This is really incredible.
So Larry, I've never actually thought about this before, but as you described what the founders might have thought, I got to believe they would love the idea that the specialists come to the family practitioner. It's not the family practitioner sending our patients out into the hinterlands to the people who are smarter than we are, and we never know what happens. Within the church health model, it's just the opposite of that. I mean, I just described to you a patient where the cardiologist came into the room with me. That is a better way of practicing medicine.
So I've been acquainted with a few models throughout the country over the years that have used this idea of bringing the specialists, the subspecialists in to the primary care facility. But that doesn't happen very often. It should happen a lot more often. But what you've created is really a model, and I'm really excited about that. So what are your thoughts about going forward in terms of continuing to grow this approach to health and this approach to healthcare delivery?
Well, look, the driving force behind what we do is the fact there's remains so many people uninsured in America. Even in states that have expanded Medicaid, there are many, many people who remain uninsured, not the least of which anybody who might, heaven forbid, be undocumented. Politically on the left and the right, we throw the undocumented people that help care for our lives under the bus when it comes to healthcare. So there is a need for the type of work we do all over the country. But even if you have insurance, the model for what we do, it is a better model. It can't just be giving people pills. How did it ever come to be that as any type of doctor, we think that chemistry is the only way our bodies function, when we know that our brain, our hearts, our muscles are more electrical devices than they are chemical devices. Giving somebody a pill that impacts your chemistry for what is fundamentally a chemical issue, an electrical issue, that doesn't make any sense. And so for that reason, we believe that trying to find ways beyond just writing prescriptions has got to be a better plan. We'll start with nutrition. Food is medicine. Now, we also know that bad food is bad medicine and good food is good medicine. But very few doctors, even family doctors, are not very astute around how food actually impacts a person's life. And then there's too much of our own lives where it's like, do what I say, not what I do. So our approach is really to try to disenfranchise Dr. God, and realize that healthcare is a group process. So to try to find ways to have partners that are counselors, health coaches, dietitians, the whole array that we have engaged here at Church Health. This is just, it's common sense at some point, but unfortunately our economic structure for healthcare is what stands in the way for really growing these types of models.
So Scott, could you comment on, speaking of nutrition, so I had a chance while I was there, you took me on a tour and I got to see some of the facilities. You have some very well-developed nutritional support services beyond just having a nutritionist available. Could you elaborate on that a little bit?
Yeah, so this whole idea of culinary medicine, but food is medicine, is at the center of much of what we do. So we, for a while, partnered with Tulane Medical School, but now have sort of gone off on our own endeavor to develop a curriculum to train our residents, to train medical students about how you engage patients with food. And it begins with getting that young healthcare provider in the kitchen and turning them into a chef. But it also allows them to not only better understand the nature of food and how it on a practical level works with patients, but we go beyond that. We have volunteers that come in and cook meals in our kitchen that are made available so that when our patients who we believe are food insecure, they can leave not only with a prescription for their medicine, but leave literally with food for dinner that night. And we begin this process of trying to engage people over the power of food.
So let me ask a little bit more about that. So are you having your residents or medical students learning how to develop their culinary arts?
Absolutely. You come to our residency, you're going to leave here a chef.
That's it, you're kind of being double boarded then, right?
I need to think about that. If there's a way to get boarded as that way, we're going to go down that path. But look, I mean, medical school doesn't teach you squat about nutrition. I mean, everybody I know, I mean, you just have the same course over and over again. And then even in family medicine, a residency doesn't teach you about food. It teaches you how to give somebody a diet sheet. Or maybe you are able to, refer them to a dietitian, which you never know whether it happened. Now, one really great benefit for us on this level around COVID is that we are done having patients meet face-to-face with our dietitians. Because what we have learned is our dietitians can now meet via Zoom with our patients, and it allows the dietitian to look directly into the refrigerator and the pantry of that patient. And the dietitian can walk that patient through cooking a meal. This is such a better way of doing this. But we're also engaging medical students and residents over how they can be more proactive around this as well. Now, on the movement side, we have 25,000 square feet that is Church Health YMCA. It's 25,000 square feet of Church Health space that we've contracted with the Y to manage. And our patients can be fully engaged with this. But yet, if a patient, if a young doctor sees somebody who we think needs to move more, well, rather than just embarrass them with how they get no exercise, we can just get up out of the exam room and go for a walking visit on our indoor track. And we can be modeling the very things that we are talking to patients about what they should do. That type of shoulding never works.
That's just really exciting. And if any medical students are listening to this, if you are looking for a residency program where you can learn how to be a chef, in addition to being a very competent and well-rounded family physician, um, this residency program, I think, is something that would very much appeal to you.
Well, can I, on just one more level on the food thing. So I mentioned that we have a high school in our building, Crosstown High School, and the ninth graders actually have their biology class in our kitchen, and they are learning biology through food and through the development of that. And our residents now have the ability to be engaged in school-based healthcare that goes beyond just wearing a white coat into a school, where you actually can engage kids in the ninth grade around issues of food and biology while we're cooking this meal together. This is both more creative, and I can assure you it's a lot more fun.
I think I need to sign up for a fellowship or something. Even at this stage of my career, I could learn pick up a few new skills. I think spending some time with you folks. So Scott, I'm going to bring things to close here, and with your permission, we'll have your name and email address at. In fact, do you want to mention your email address right now, just so it's part of this recording?
Yeah, so my personal email address is Morris, MORRISS, 2 R's, 2 S's, at churchhealth, one word, .org. And the Church Health website is just churchhealth.org.
Great. So this, from some people, may sound like it's too good to be true, but I have been there more than one time, and it is a total, it's just brilliant. I don't know what else to say about it. And I wish we could find ways to replicate this model. Now, one of the things I did want you to comment on, I know that you offer a course for other communities that are interested in replicating the church health model. Could you mention a little bit about that?
Right. So the entity is called ECHO, Empowering Church Health Opportunities. It has its own website, which is echoclinics.org. And so what ECHO does is, once a community has decided, we want to go down this path of creating a faith-based, privately funded health clinic. So what we are not, and what we don't help with are FQHCs. We're not a federally funded anything. This is all about the private sector doing what we believe God has called us to do. But if in a community you want to do that, what ECHO does is help you get off the ground. It's effectively free consults. Free, you can be struggling at some point. So ECHO will come into your community, help you figure out where you get to next. And then we invite you to Memphis for a 2-day experience of the work we do, that you get our full undivided attention to help you decide how you will do this in your own community. And there are roughly 60 clinics out there that are modeled after Church Health, and they range from Texas to New Jersey to LA.
Great. So I'm hoping that will continue to grow. And if the FMEC can help that to happen, just let me know what we can do. I think that's fabulous.
We would love to be partners with you at any level.
Cool. So Scott, thank you so much for spending time with me today. Thank you so much for what you're doing to change healthcare in America. And again, if there's anything that I can do to be of help, please let me know.
It was my honor, Larry. Thank you for taking the time to learn more about the work we're doing here in Memphis.